The most avoidable deaths in every hospital. Every one of these 4 patients died from a mistake that should have been caught. Not negligence in the dramatic, malicious sense. Wrong doses, missed signs, exhaustion, and silence that nobody flagged in time. Here are 4 hospital deaths that became famous specifically because the families involved refused to let them be forgotten, and the rules that exist today because of them. Libby Zion, the 36-hour shift. In March 1984, 18-year-old Libby Zion was brought to the emergency room at New York Hospital with a fever and strange jerking movements. She was seen by a first-year intern and a second-year resident, both of whom had already been on shift for over 18 hours. No senior attending physician examined her in person that night. The young doctors didn't know Libby was taking an antidepressant called Nardil. When they prescribed a painkiller called Demerol to calm her agitation, the 2 drugs interacted catastrophically, triggering a condition called serotonin syndrome that was barely understood at the time. Libby grew increasingly agitated. The staff restrained her and added a sedative. Hours later, her temperature spiked, her heart stopped, and she died before sunrise. Her father, a former New York Times writer, refused to accept the explanation he was given. He spent years pushing for a criminal investigation, a state inquiry, and a civil trial, insisting publicly that exhausted, unsupervised residents weren't fit to make life-and-death decisions alone. New York eventually passed the first law in the country limiting medical residents to 24-hour shifts and 80-hour workweeks. Within 2 decades, that limit became the national standard for every hospital in America. Betsy Lemon, the 4-fold dose. In November 1994, 39-year-old Boston Globe health columnist Betsy Lemon was admitted to the Dana-Farber Cancer Institute for an experimental high-dose chemotherapy protocol, part of her treatment for breast cancer. A member of her clinical treatment team misread the dosing instructions and ordered 4 times the already aggressive amount of the drug cyclophosphamide every day for 4 days straight. 2 layers of pharmacist review were supposed to catch a mistake exactly like this one. Neither caught it. Lemon's body began reacting violently to the overdose, vomiting and showing signs of severe cardiac strain, but the connection to a dosing error wasn't made while she was still alive. She died on December 3, 1994. It took hospital staff nearly 3 months afterward to even discover that an overdose was the cause. The case became one of the most publicly scrutinized medical errors in American history, with dozens of front-page headlines over the following years. Dana-Farber overhauled its leadership, its drug verification process, and its entire safety culture in response, changes that researchers later credited with helping prevent further chemotherapy deaths there for decades afterward. Josie King, the missed signs. In January 2001, 18-month-old Josie King was recovering at Johns Hopkins Hospital from severe burns after a bathtub accident. Her treatment was going well, skin grafts had taken, and she was days from going home. Then, her behavior changed. She screamed at the sight of a drink and sucked desperately at a washcloth, something she'd never done before. Her mother, who had barely left her side for 2 weeks, asked the nursing staff if this was normal. She was reassured it was fine. Overnight, Josie's condition quietly worsened. The next morning, doctors gave her Narcan to reverse a suspected narcotic overreaction, and a verbal order went out: no more narcotics for Josie. Hours later, a nurse arrived with a syringe of methadone anyway. Josie's mother reminded her of the order. The nurse said it had been changed, and gave the injection. Josie's heart stopped shortly after. She died 2 days later from a combination of severe dehydration and the inappropriate narcotic, complicated by an infection she'd picked up during her stay. Her parents used their settlement to fund a foundation in her name, eventually partnering directly with Johns Hopkins to help build some of the patient safety systems, like rapid response teams parents can activate themselves, that are now standard in hospitals worldwide. Rory Staunton, the 3-day delay. In March 2012, 12-year-old Rory Staunton scraped his arm diving for a basketball in gym class. By that night, he was vomiting and complaining of leg pain. His pediatrician diagnosed the flu and sent him to the emergency room for fluids. Doctors there ran blood tests, gave him fluids, and discharged him with a diagnosis of an ordinary stomach bug. Nobody had reviewed his blood work results before sending him home. They showed clear warning signs of a raging bacterial infection. Rory's symptoms kept getting worse over the next day. By the time his parents brought him back to the hospital, the infection had become full-blown sepsis. He died on April 2012, 4 days after a scrape on his arm at school. His parents turned their grief into one of the most effective patient safety campaigns in American history. Within a year, New York passed Rory's regulations, forcing every hospital in the state to adopt rapid sepsis screening protocols. Within 5 years, state health officials estimated the rules had saved more than 16,000 lives. None of these 4 deaths involved a villain. They involved exhausted residents, a misread dosage, a verbal order nobody double-checked, and blood work nobody looked at twice. In every case, it was the people left behind who turned a single preventable death into a system that catches the next one before it happens.